Hello everyone. I hope I'm live. I'm clearly visible and audible to you people. Let me confirm. If I'm clearly visible, audible, I will start the lecture ahead. You have to give me a minute for confirmation if I'm clearly visible, audible. You can give me a thumbs up in the chat box if you can see me. Okay, yeah. I hope it is working. Okay, so let me start. So I welcome you all for today's session. A very good morning to all of you. I am Dr. Priyanka Sachdev here, and today I am here to take a very important portion from pharmacology. We have started this pharmacology series. In this pharmacology series, we have started general pharmacology, and we have already completed pharmacokinetics, which was very important portion from general pharmacology. And today I am here to continue with pharmacodynamics, right? So I'm going to start pharmacodynamics today. So let me start. So as we all know that in pharmacology, we are having two branches. Pharmacology is the drug of science. We are having pharmacokinetics and pharmacodynamics. This is pharmacokinetics. This is pharmacodynamics. So whenever a person takes any drug for any disease, to treat any disease, what the drug does to the body is pharmacodynamics. That is our chapter today. That is D for D. So if I'm having headache, I'm having migraine, I'm taking a drug for it, a tablet for it. So drug will act on the brain parenchyma, the blood vessels of the brain parenchyma and treat it. If I'm having diarrhea, the drug will go and act on the intestine. If I'm having bradycardia, the drug will go and act on the heart. So likewise, whatever disease I am having, the drug is going to that particular organ and showing its mechanism of action. So what the drug is doing to the body is known as pharmacodynamics. That is our today's chapter, right? So give me a thumbs up if I'm clearly visible, audible. Are you people there? Okay. So that is, and we have already completed pharmacokinetics. What the body does to the drug, not drug to body. What the body does to the drug is pharmacokinetics. So if I'm taking any drug from mouth, by mouth, you can see the drug will go in the esophagus, it will go in the stomach, it will go in the intestine. So first thing, drug will be absorbed from the stomach and intestine and reach the blood vessel. This is known as absorption. So body is absorbing the drug. After reaching in the blood, the drug will go to its site of action to show its mechanism of action. So this step is known as distribution. The body is distributing to the drug. After distribution, the drug has already shown mechanism of action. This will come under pharmacodynamics, right? But now drug want to get excreted out of the body, right? Drug cannot remain in the body forever. But before excretion, drug cannot be excreted directly. Drug have to convert from non-polar to polar form. Then only drug can be excreted. So this step is known as metabolism and last step is excretion. So pharmacokinetics have four parts. Body, what the body is doing to the drug, body is doing four things to the drug. Body first absorbing the drug, then distributing to the drug, body is then metabolizing the drug, and body is then excreting to the drug. So what the body does to the drug is known as pharmacokinetics, and pharmacokinetics have four portions, four chapters. We have already covered all these chapters, I guess, right? So let me start with pharmacodynamics now. Let me start with pharmacodynamics today. We have completed that, and let me start with pharmacodynamics. What the drug does to the body. Here mechanism of action of the drug will come in role. So what is the definition of pharmacodynamics, which is written in the books? So the branch of pharmacology which deals with biochemical and physiological effects of the drug and their mechanism of action is known as pharmacodynamics. Give me a thumbs up if you got this definition. So in pharmacodynamics, there is a very important graph or very important curve which you have to understand. I will show you. I will explain you all mechanism of actions of the drugs, various mechanism, transducer mechanism and receptors also in the next lecture. Here in this lecture, I am going to discuss a very ultra important topic from pharmacodynamics, that is dose response curve, which is known as DRC. Dose response curve, DRC. Everyone give me a thumbs up. Are you people there? Now, what is DRC? What is dose response curve? What do you mean by that? Dose response curve. So as the name indicate, dose response curve, it is a curve. Curve means graph. So let me draw a graph. Can you see? It is a graph having x-axis, having y-axis. So on x-axis, I will take the dose of the drug. I will take the dose of the drug present in plasma. That is plasma concentration of the drug. Dose of the drug in the plasma. That is plasma concentration of the drug. And on y-axis, I will take the response. I will take the response. So how the graph will be formed? If I take dose and response on each axis. Okay, I will draw it. So let me take dose here and let me take response here. What do you mean by that? Let me explain you the graph, then I will come on the significance of the graph. Just suppose my patient is having edema. For the treatment of edema, I am giving diuretics to the patient. What are diuretics? What are diuretics, furosemide? What does they will do? Diuretics will excrete the extra water from the body in urine. So whenever a patient take diuretics, the response is just by the amount of urine, the volume of urine the patient is passing. So if a patient is taking less dose of diuretic, less urine is passed. If a patient is taking more dose of diuretic, more urine is passed, right? So just suppose I am giving 10 milligram, 20 milligram, 30 milligram, 40 milligram, 50 milligram, 60 milligram of the diuretic. So how many liters of urine is passed? So whenever I am giving 10 milligram, 1 liter of urine is passed. Whenever I am giving 20, 2 liter is passed. Whenever I am giving 30, 3 liter of urine, 4 liter of urine, 5 liter of urine. But this is maximum, right? So how is the graph? So graph is like this. Graph. So it is directly proportional. On increasing the dose, response is increasing. See, please understand, on increasing the dose, the response is increasing. On increasing the dose, the response is increasing. On increasing the dose, the response is increasing. But after a certain point, it becomes constant. Now you are increasing the dose further, but response is not increasing beyond that. So response is same at 40 also, at 50 also, at 60 also. It becomes constant, but 10, 20, 30, it is increasing gradually. Now give me a thumbs up if you got this graph. It is very important graph. So this is the graph we are getting between dose response curve, that is known as DRC. You got it? So this is DRC curve, you should understand. Dose response curve. So I have taken dose on the x-axis. You can see the shape of the graph. I am taking dose on the x-axis and response on the y-axis. By dose, I mean plasma concentration of the drug. So initially it is constant. Initially it is directly proportional, so it will increase. Once I increase the dose, the response is increased. Once I increase the dose, the response is increased. But after a certain point, it becomes constant. So what is this shape known as? What is this shape known as? This shape is hyperbola. This shape is known as, if you in mathematics you have understood that this is hyperbola. Hyperbola shape of the graph. So initially it is directly proportional, but later on it will become constant. So this shape is known as hyperbola. Now doing calculations on hyperbola is difficult. Calculations on hyperbola is difficult. So we have changed it little bit. We have changed it a little bit. What we have changed? Initially we were taking two things. Now also I am taking two things. One is x-axis, one is y-axis. On y-axis, I am taking response. On y-axis, I am taking response. But on x-axis, initially I was taking dose in gram, in milligram dose. So the shape was hyperbola. The shape was hyperbola. Now instead of dose, I am taking logarithm of the dose to simplify the shape of the graph. You know logarithm, in mathematics we study logarithm. So here I am taking 10, here I am taking log 10, logarithm of 10. Here I am taking 20 milligram, here I am taking logarithm of 20. So in the same way, I'm trying to drawing the graph again. So here the shape is same, it is hyperbola. Initially it is directly proportional, later on it become constant. But here the shape will become sigmoid. Here the shape, now tell me the two shapes. This shape is hyperbola and this shape is sigmoid. Now doing calculations on hyperbola is difficult, but doing calculations on sigmoid are easier. So we don't use dose response curve, DRC. No, we use log dose response curve. Log dose, logarithm of the dose and response curve. So this we use nowadays. Everyone give me a thumbs up if you got the basic. Then I will go on the calculations, how we do calculations in log DRC. So you have to understand that. So give me a thumbs up if you got this point clearly. Should I move ahead? Give me a thumbs up. It is a very important topic, right? So I am going to take logarithm of dose response curve. Logarithm of the dose response curve. So this is dose response curve and here it is the logarithm of the dose response curve. Now compare the shape of the two graphs. Whenever I was using dose, it is hyperbola, and whenever I am using logarithm of the dose, it is becoming sigmoid. So this shape is hyperbola and this shape is sigmoid. Sigmoid, you got it? And why we are doing so? We are doing so? To ease the calculations, to ease the mathematical calculations and comparison. So we are using logarithm of the dose. So the shape will become sigmoid instead of hyperbola. So there are two types of curve, DRC and log DRC. So I will teach you log DRC. Log DRC. Give me a thumbs up. You are not giving the thumbs up. Please compare the two graphs. So whenever you are using dose DRC, this is the shape with the red color. And whenever you are using logarithm of the dose instead of dose, so this is the shape of the curve. So compare the two shapes. This is sigmoid and I'm sorry, this is hyperbola and this is sigmoid. You got it? Give me a thumbs up if you got it. Now coming on the calculations part, which is the most difficult topic to understand here. Now you will say, ma'am, being a doctor, how does these curves are useful for us? Why we should study these curves? These curves are very useful for you people Because whenever you will prescribe any drug to your patient, you should know four things about the drug before prescribing any drug to your patient. You should know what is the potency of your drug. If you have two drugs for the same disease having two different brands, just suppose any disease, there are two companies, two brands which are launching the same formula or a different formula for the same disease, right? So for just suppose for migraine we have one drug A, one drug B, or for any disease we are hypertension we are having multiple drug A, B, C, D. So you should compare the potency of all drugs. For comparison of potency we require DRC, log DRC. You should know the efficacy of the drug. You should be able to compare the efficacy of the drug. You should be able to compare the efficacy of the drug between multiple drugs. If you are given multiple drugs, you should be able to compare the slope. Why slope is important, I will tell you. And you should be able to compare the therapeutic index and therapeutic range. Two things are different. Therapeutic index is different, therapeutic range is different. So the graph is useful to calculate five things. Have you got it? So Kuldeep, I have just started, so I am going to teach you dose response curve. So dose response curve is this one. So we are creating a graph between two things. I am taking x-axis, see this is x-axis and this is y-axis. So on x-axis, I am taking logarithm of the dose. Just suppose I am having any disease. I am having migraine. For migraine, or just suppose the patient is having edema. For the edema, you are giving diuretics to your patient, right? So you are giving 10 milligram, 20 milligram, 30 milligram, 40 milligram, 50 milligram. You are giving diuretics. On y-axis, you are judging the response. So whenever you give diuretics, the response is judged by amount of urine, how much urine the patient is excreting. So 1 liter, 2 liter, 3 liter, 4 liter. So you will see initially the graph is directly proportional. You are increasing the dose, the response is increasing. You are giving 10 milligram, patient is excreting 1 liter. You are giving 20 milligram, patient is excreting 2 liter. You are giving 30 milligram, patient is... So initially it is directly proportional, but later on it becomes constant. So 40, 50, 60, 70, at all the response is same. So this shape is hyperbola, but instead of dose, if we take logarithm of the dose instead of hyperbola shape, we will get sigmoid. So nowadays we use sigmoid, this shape. We don't use this shape for calculations because doing calculations in hyperbola are difficult and in sigmoid they are easy. Now please understand. So this is DRC. Now being a doctor, why a DRC is useful for you? So you have multiple drugs for the same disease. For migraine, for diarrhea, for one disease, you have multiple drugs. Now, which drug you will prefer for your patient? Your patient trusts you, right? So patient is coming to you, doctor, I am having this complaint. Please give me some drug and treat my disease. So there are multiple drugs available in the market for the same disease. You can give drug A also, B also, C also, D also. Which drug you will prefer in your patient? You should able to compare the potency of all of them, and the one which is having highest potency, give that drug, right? There are multiple drugs available, so all have different efficacy. So compare the efficacy of all of them. The one which is having highest efficacy, give that drug, right? Compare the slope of all these drugs. For why slope is important? Some is having flat slope, so they are safe drugs, and some is having very steep slope, so they are dangerous drugs. So you should be able to select which drugs are safe, which are dangerous, and what is the therapeutic index and therapeutic range of these drugs. So based on these criteria, you should decide which is the best drug for your patient for that particular disease. So these DRCs are very important to understand, right? So I will take all these criteria, the important parameters one by one, and help you in understanding how we do the comparison of potency in DRC of multiple drugs, how we do the comparison of efficacy in DRC, how we do the comparison of slope, and how we do the comparison of therapeutic index and calculate therapeutic index and therapeutic range for that particular drug. Give me a thumbs up, Kuldeep. Have you got it? Give me a thumbs up. So here I will use this graph. So I am not using dose response curve. No, because here the shape is hyperbola. Instead of dose, I am using logarithm of the dose. Logarithm. So I am not using 10 milligram. I am using log 10 milligram. I'm not using 20 milligram. I'm using log 20 milligram. You got it? So here when instead of dose, I take logarithm of the dose, the shape of the curve becomes sigmoid. You will say, ma'am, why you are doing so? It was good. But here, doing calculations in hyperbola or doing comparisons, it is difficult. In sigmoid, the comparisons are easy. So we will use this curve in all the parameters, the sigmoid one, right? So let me talk about one by one. Let me start with potency. Can any one of you, anyone, those who are listening to me, can tell me the difference between potency and efficacy of the drug? My question to you, can any one of you can tell me the difference between potency? What is potency of a drug? And what is efficacy? The first two parameters, efficacy of the drug. What do you mean by that? Can you define them? What is potency of a drug and what is efficacy, and why we should compare the potency of multiple drugs and why we should compare the efficacy? Anyone knows? Kuldeep, do you know? Or anyone else who is listening to me? Do you know? Let me see. Can I see your chat? Just a second. Just a second. Yes, I can see your chat. So, Shweta, Kuldeep, anyone? Do you know what is the difference between potency and efficacy? Okay. Let me tell you. Let me tell you. So, just suppose patient is having fever. We will take multiple examples. Huh? So, patient is having a fever of 103. 103, he is having fever, right? Now, you want to decrease the fever and you want to normalize the fever. You want some drug which is acting as antipyretic. So multiple drugs are available in the market, drug A, drug B, drug C, right? There are multiple drugs. So all of them reduce the temperature and do the normal body temperature, whatever normal body temperature it is, 98 point, whatever normal body temperature is this, they all can do. But drug A, whenever you take 10 milligram of the drug, it will do so. Drug B, whenever you take 20 milligram, it will do so. And drug C, whenever you will give 100 milligram, so the dose, at different doses, they are giving the same response. All of them are reducing the temperature from this to this. So all of them are effective for the patient, but they are required at different concentration. You got my point? Not for only fever. You can assume any disease, right? So the patient is having diarrhea. Just suppose the patient is having diarrhea. You want to normalize the intestinal gut. You want to normalize the diarrhea. You want to normalize the motion, right? So you have again three options, A, B, C, multiple options. So all of them can do, but at different doses. So that which drug is good? The drug which is required in 10 milligram or the drug which is required in 100 milligram for the same response. Response is same. We are doing the same response. So for the same response, this is the response of the drug. How much dose is required? Which drug is good? The drug which is required in low, common sense now. The drug which is required in low dose or the drug which is required in high dose? Please answer. I'm asking to you. Please answer anyone. Which drug is good? Which, being a doctor, which you will prefer to your patient? So your patient is having some particular disease. You want to treat the disease. You have three options with you. Drug A, B, C. All are able to treat your disease, right? All will be able to treat your disease, treat the disease of your patient. But one drug is required in low concentration to do that job and one drug is required in high concentration to do that job. So which you will prefer for your patient? Of course, common sense says yes, Kuldeep, absolutely right. You will prefer the drug which is required in low concentration, right? So drug is good. So the drug which is required in low concentration for the same response is highly potent. Why drug only 10 milligram is required for A? Because A is more potent than B and C. Because drug A is more potent between as compared to drug B and drug C. All of them are effective. They are doing the same response. Efficacy wise, they are same. Effectivity, they all are giving the response, but at different doses. So the one drug which is doing at small concentration, so it is potent because it is doing at small concentration, and the one drug which require high concentration to show the same response, it is less potent. So from ABC, A is most potent and C is least potent and B is intermediate. So that is the comparison of potency, A followed by B followed by C. So this is the order. This is the order. Give me a thumbs up. Everyone give me a thumbs up. Just a second. Okay, yeah, everyone. Yes, Shweta, you are also right. Rishinika, you are also right. Have you got it? So that is the comparison of the potency. So what is the definition of potency? You tell me. It is the amount of drug which is required to produce particular response. I'm not changing the response. Response is same. I want to reduce the temperature of the patient, the fever of the patient from 10 not to 98. I want to normalize. So response for all of them is same, but different drugs are required in different amount, right? So it is the amount of drug which is needed. Give me a thumbs up. So how I will, amount is taken on x-axis. Now you know the graph well. This is the graph. This is the graph. So on x-axis you take dose. On y, dose actually logarithm of the dose. Actually, I will write dose, but it is understood it is logarithm of the dose, right? I will never take dose alone. I will take logarithm of the dose, and on y-axis you will take the response. So amount of the drug will be measured on x or y. It is on x-axis. So I am talking about x-axis. Yes or no? So on x-axis it will vary. The potency can be seen on the x-axis. Give me a thumbs up. Now let me show three drugs to you. Let me show three drugs to you. So this is the curve for drug A, this is the curve for drug B, and this is the curve for drug C. A, B, C. There are three curves in front of you. Now you will tell me which is most potent. Which is most potent out of the three? Which is most potent? Okay, should I simplify for you? Once let me explain, then you have to answer this. Okay, let me explain. So you want a particular response. Just suppose you want this response. ये एक response fix कर लेते हैं, right? You want this response for by all of them. So for this particular response, fix any response, any. So this response is constant for all of them. For producing this response, see, drug A is required in this concentration. Drug B is required in this concentration. And drug C is required in this. So let me start from 0. It is 0, it is 10, it is 20, it is 30. So for producing a particular response, see, this is my response. This is my particular response. For particular response, drug A is required in 10 milligram. B is required in 20 milligram and C is required in 30 milligram. So you will tell me who is the most potent. So A is the most potent and C is the least potent. So can I make a rule? Yes, you all are right. Very good. Can I make a rule? On the DRC, you plot various drugs. So not only 3, you can plot 10 also, 100 also. How many you want to compare? Plot all of them. So plot all the drugs on DRC, log DRC actually, log DRC pe you plot all of them. You will get multiple sigmoid shape. So make a rule that lefter is the drug, more potent it is. Righter is the drug, least potent it is. So the drug which is on the left side, no, see, left side, your left side, your right side. Your left side, it is A. And your right side, it is C. So the drug which is on the left side is most potent. Make a rule. So you don't have to use your brains every time. You learn the rule. You understood what I mean. You can apply the rule anytime, but you don't have to apply in your exam and waste your time. So lefter is the drug, more potent it is. Give me a thumbs up. Everyone give me a thumbs up. So what is potency? You tell me the definition of potency. Who will tell me? Who will tell me? It is the amount of the drug which is needed to produce a particular response. Response is same, which I will fix. So for producing that response, how much A is required? How much B is required? How much C is required? Tell me how much gram of each of the drug is required. So for producing the same response, the drug which is required in lower dose is more potent, whereas the drug which is required in large dose are less potent. So potency is inversely proportional to the dose. And we have make a rule, the drug which is on the left side is more potent. So see this graph. Now you can use your brains also, you can apply the formula also. You can see two drugs, drug A, drug B. Now compare, this is logarithm of the dose on x-axis and potency, response on the y-axis. So of course it is a log DRC. So in log DRC, the left is the drug. So who is on the left side, A or B? Who is on the left side? Of course A is on the left side and B is on the right side. So who will be more potent? You tell me. A will be more. So potency wise, this is the order. Potency wise, this is the order. A is more potent than B, right? And you can apply it also. If you don't want to learn the rule left, right, you can apply it also. So just suppose I want this 0.6 response. Let me fix the response, 0.6. So for producing 0.6 response, how much A is required? I guess 30 milligram. And for producing 0.6 response, how much B is required? I guess 55 milligram. So this A is required in 30 milligram for producing a particular response, but B is required in 55 milligram for producing the same response. Everyone give me a thumbs up. So you can apply it every time, or instead of applying, learn the rule. Left is the drug, more potent it is. Give me a thumbs up. Now in this graph you can see 3 drugs. Drug A, drug B, drug C. You tell me potency ka order. What is the order of potency? A followed by B followed by C, or C followed by B followed by A, or B followed by A followed by C. So these are your 4 options A, B, C, D. So of course, left is the drug, more potent it is. Right is the drug, least potent it is. So order is A followed by B followed by C. Everyone give me a thumbs up. Everyone. You can apply it again. You can apply the same formula. Just suppose this is my response. Let me fix the response. So for producing this response, how much this is required, how much this is required, and how much this is required. See the concentrations. So lower the concentration, higher is the potency. Everyone give me a thumbs up. So I am done with potency, right? So you can see various graphs and the answers. So I will ask many polls to you. Let me finish all 4, then I will launch the polls. So that is the order of potency. Let me come on efficacy. What is efficacy? Can someone tell me? So potency is measured on x-axis. X-axis. That is, it is the amount of the drug or dose of the drug or amount of the drug which is required to produce a particular response. And the rule says the left is the drug, more potent it is. So this is the summary of potency. Let me come on efficacy. What is efficacy? What is efficacy? What is efficacy? Who will tell me? Who will tell me what is efficacy? Okay. Again, let me take the example of both. Potency, you already understood. Potency. Now let me tell you efficacy. Which drug is more efficacious? Which is less efficacious? Efficacy. It is difficult to understand. Huh? I'm trying hard. Listen, okay, just suppose taking the same example, right? The patient is having headache. So I'm having headache. I'm having headache is my disease. You can take any disease, huh? Headache. So I will see the response. Now I'm having 3 drugs to treat the headache. Drug A, drug B, drug C. So drug A, whenever I am taking drug A, the maximum headache, I'm having a headache, I'm considering my headache, whatever I'm having, it is my 100%. Whatever I'm having right now, the headache, I'm not having headache, this is just an example. Whatever I'm having right now, this is 100%. I'm assuming the baseline is the 100. So right. So after that, I took drug A. So drug A, maximum it can treat my headache only, it can reduce my headache only by 20%. So 20% response it can show. So 80% is still there, right? Drug B can show 50% of the response. So 50% is still there. And drug C can produce a response 90%. So only 10% is remaining. So which is producing, so which you will prefer in your patient? You will like to give drug A to your patient, maximum response. At maximum, matlab or dose बढ़ा के we cannot increase the response by this. So maximum response produced by A is reduction by 20% of the disease. B, reduction by 50% of the disease. And C, reduce the disease by 90%, so only 10% is remaining. So which you will prefer? Yes, of course, Kuldeep, you will prefer drug C. So you want maximum. So which is more efficacious? So here drug C is most efficacious. So the drug which produce maximum response. Here I am talking about response. I am not talking about dose. Dose कुछ भी लगे, ये 10 लगे, 20 लगे, 50 लगे, it doesn't matter. Response कितना produce कर रहा है. So for a patient, if you ask your patient, okay, you have 100% patient, how much I should treat? So of course the patient might treat 100%. Of course I want the cure. Please treat everything. So whatever dose you will say I will take. You will take 10 milligram, I will take it. You will take 100 milligram. So dose doesn't matter for the patient. Patient के लिए matter करता है, disease should be treated. So you treat my disease 100%. So the drug which is having high efficacy, you should prefer that drug to your patient. Yes, you all are right. Have you got it? Have you got it? What does I mean? So here I am measuring the response. The drug having more response, having more efficacy. So, okay, let me give a comparison. So, there are two criteria, potency, just a second, I'm sorry, potency and efficacy. So, what do you mean by that? Potency is the amount of drug or dose of drug, right, that produces a particular response. So it is measured on x-axis, and efficacy is the response, maximum response of the drug which the drug can produce. So response is measured on y-axis. Response is measured on y-axis. You got this? So let me show you various graphs for the efficacy. So this is the formula or definition for efficacy. It is a maximum effect or maximum response produced by a particular drug, and it is seen on y-axis, right? So let me draw a graph again for you people. So of course it is dose, means logarithm of the dose. And this is response. This is response. I am having three drugs, A, B, C. So see the graph of all of them. So this is the graph of the first drug. This is the graph of the second drug. This is the graph of the third drug. Who will tell me which is most potent? Okay, let me name them. This is drug A, this is drug B, this is drug C. So tell me two answers. Which is most potent? What is the order of potency? My first question. Potency का order बताओ. And what is the order of efficacy? What is the order of efficacy? Efficacy का भी order बताओ. Who will tell me? Okay, let me solve one by one. Potency, which is most potent? The one which is on the left side is most potent. Yes or no? So order of potency is A followed by B followed by C. That is A is most potent and C is least potent. Yes or no? Yes or no? Yes, you all are right. What is the order of efficacy? Let me come on efficacy now. So efficacy is measured on y-axis. Y-axis. See, this is the response. Let me draw the response for you people. It is 10, 20 percentage, 10% reduction, 20% reduction of the disease, 30% response, 40% response, 50% response, 60% response, 70% response, 80% response. You want 100% response. The best drug have 100% response, so the disease is cured. The disease is eliminated from the body, cured from the body. You want 100%, right? So whenever you are giving drug A, the best response you can get is only 50%. B is 70% and C is only 30%. So which drug is best according to efficacy wise? So efficacy wise, B is the best. B. So you are measuring on y-axis, not on x-axis. You are measuring the efficacy on y-axis. This is y-axis. It is response. So order is B followed by A followed by C. Yes, you all are right, Kuldeep. Very right. So B followed by A followed by C. So B is having highest efficacy and C is having lowest. So B is having highest and C is having lowest. Have you got it? And if you see the potency wise, you have already seen the potency wise. Fix a particular response, any particular response which is common for all. So let me fix this response only, which is common, क्योंकि common maximum C का यही हो सकता है. So this drug is required at what doses? This drug is required at what doses? This drug is required at what doses? So compare. This is 10 milligram, 20 milligram, 30 milligram. So lower the dose, higher is the potency. So this is measured on x-axis. So potency is measured on x-axis, efficacy is measured on y-axis. General rule for potency you already know. Lefter is the drug, more potent is this. Efficacy का general rule. Taller is the graph. इन तीनों में से tallest कौन है? Tallest कौन है? See, tall, height. See the height. So height wise, this is the tallest. So B. B is the, so taller is the graph, more potent it is. So general rule. So don't apply the concepts every time. Just see, left side में है तो most potent है, taller है तो more efficacious है. So give me a thumbs up. So you have to see left side में है तो more potent है और taller है, it is taller. So left side, right side is on x-axis. Left and right is on the x-axis. And taller and shorter is on the y-axis. I'm trying hard here. Come on, give me a thumbs up. Everyone means everyone. Those who are listening, please everyone give me a thumbs up if you got the two concepts. What is potency? What is efficacy? Potency is the amount of drug which is required to produce a particular response. It is measured on x-axis. Efficacy is the maximum response produced by that drug. It is measured on y-axis. Right? So the general rule says if you have multiple drugs for a disease, according to potency wise, lefter is the drug, most potent it is, righter is the drug, least potent it is. And according to efficacy wise, general rule says it is measured on y-axis. So taller is the graph, it is more efficacy. Shorter is the graph, it is least efficacy. You are not giving the thumbs up. You didn't got it? Everyone give me a thumbs up. Now, these three drugs are for the same disease. All these three drugs are for headache, which you will give in your patient. So you will say, ma'am, how we can decide? How we can decide? See, what is the dilemma? You can see what is the dilemma here. Please everyone appreciate the dilemma. Please everyone appreciate. If you say, ma'am, potency wise, we go A is best drug. But efficacy wise, we go B is the best drug, right? C is least potent and least efficacious, so out of the rule. But out of A and B, what should be your answer? You tell me. You tell me which you will prefer in your patient. Now, तुम धर्म संकट में फंस गए. So, क्या करोगे? What you will do? What you will do? What are the guidelines? What you should do? So, if you see potency wise, A is the best drug to be given to the patient, right? And if you see efficacy wise, B is the best drug to be given to the patient. C is out of role because it is the least potent and least efficacious. So you will prefer A or B. That is my question. That is my question. Please answer anyone with some concept. It is not tukka, it is a concept. Which drug you will prefer in your patient? Both are for headache. Drug A, B, C, all are for the headache. Patient is having migraine headache. I want to treat the headache. So which I will prefer? Okay, so Kuldeep, Rishinika, you are saying B. Why? You are right, but why? Clinically, efficacy is an important criteria, more important criteria as compared to potency. Why? Understand it now. It is very easy to understand. So there is a patient in front of me. I'm asking, what is your complaint, Mr. Mrs. What is your complaint? So patient is saying, doctor, I'm having severe headache. Please treat it. I'm having very severe headache. Please treat it. Give me some drug and treat it. So at that instant, what matters for the patient? For the patient, it matters. I will explain the patient, Mr. I'm having two drugs for you, drug A and B. Drug A can treat your headache 90% and drug B can treat your headache only 50%. Of course, the patient will say, doctor, give me that drug which can treat it 90%. Don't give me the drug which is, so he want efficacy wise. And if I explain the drug to the same patient that the drug which is required, which produces 90% response, but it is required in high amount because it is less potent. But the drug which produces 50% response is required in low amount because high potent. So dose doesn't matter for the patient. You will say, doctor, you give me a 10 milligram tablet or 100 milligram tablet, or you give me IV injection of whatever milligram. How does it matter to me? For me, matters is the response. Please treat my headache. So doses doesn't matter for the patient, right? So clinical judgment के लिए efficacy is a strong criteria, more important criteria as compared to potency. Give me a thumbs up everyone if you got it. So you can judge ना for the patient what does it matter. उसको बोलेंगे कि एक टैबलेट है वो रिस्पॉन्स कम प्रोड्यूस करेगी लेकिन तुम्हें कम अमाउंट में लेना पड़ेगा, और दूसरी है वो रिस्पॉन्स ज्यादा प्रोड्यूस करेगी लेकिन उसका डोज भी हाई लेना पड़ेगा. ऑफ कोर्स पेशेंट विल प्रेफर कि हाई डोज में लेके हाई रिस्पॉन्स प्रोड्यूस करके ट्रीट द डिजीज. ऐसा नहीं है कि डोज कम ले लिया तो उससे क्या होगा, डिजीज इज स्टिल देयर ना. सो व्हाट इज द कांसेप्ट ऑफ टेकिंग इट लो डोजेस? So that is the concept. Have you got it? Have you got it? Yes, response matters, Kuldeep. So if you have discrepancy between the two, take a drug which is having high efficacy. Give me a thumbs up. So what is efficacy? Let me summarize what is efficacy. So efficacy is the maximum response which is produced by a drug. It is measured on y-axis. It is measured on y-axis. So more taller the peak is having, that is having more efficacy. So here in this graph, who is more efficacious? Who is having more efficacy, A or B? A or B? See the height. See the height. So B is more efficacious than A. And which is more potent? This is efficacy ka efficacy ka sequence. What is the sequence for potency? Which is more potent? The drug which is on the left side. So left में तो A है. So A is more potent. So again we are at the same scenario. Again, so efficacy wise B is better, potency wise A is better. Which you will prefer in your patient? So you will prefer B in your patient. So efficacy is more important criteria than potency. So drug A is more potent than B, drug B is more efficacious than A. So you will prefer drug B in your patient if you have such scenario, right? Again, you can do the same calculations here also. So drug A, B, C, if you see the potency, answer is A followed by B followed by C, right? Apply left and right rule, right? If you see the efficacy, the order is height. See the height. See the height. Height सबसे ज़्यादा C की है, फिर B की है, फिर A की है. So C followed by B followed by A. So C now, C. So in multiple drugs also you have same confusion. So potency wise A is best. Efficacy wise C is best. So which you will prefer in your patient? You will prefer C in your patient, not A. Have you got it? Have you got it? So many good MCQs can be created on this concept. So which is more important factor? What you have learned? So efficacy is more important factor as compared to potency while selecting a drug for your patient. So efficacy is clinically more important criteria than potency. So it is the decisive factor which is required in choosing the drug. If you have a cocktail of drug for the same disease, so choice depends on efficacy, not on potency. Give me a thumbs up. Give me a thumbs up. Now you're a doctor. Of course, you are a doctor now. So patients believe in you. Patients have trust in you. So you don't have to break the trust of your patient, right? So you should know everything. If you have multiple drugs, it is not the thing that the MR who is giving more cut or more percentage to me, I should prefer that drug for my patient, so I receive more cut. No, it is a bad practice. It is a foul practice. You shouldn't practice this. Some few doctors are doing this. So multiple MR, the medical representatives from various companies, various brands come to me, ki madam, please prescribe our drug to your patient. We will give this percentage. We will give this percentage. So this bad practice is going on in the market. No, you just ask everyone who is coming, whatever MR is coming in your clinic, ask what is the potency of your drug, what is the efficacy of your drug as compared to already existing drug for this disease in the market. Compare the potency and efficacy of your drug with other drugs available in the market for the same disease. So you are launching a new drug. That's why you are here. So compare the potency and efficacy. So the drug which is most efficacious among all the options, prefer that drug for your patient. That is the best practice you should do. So before prescribing any drug your patient is having hypertension. You have a multiple antihypertensive drug A, B, C, D, E, having the chemical formula same, but brands are different. So ask for potency and efficacy. So the drug which is more efficacious, that is the decisive factor. That is my point. Everyone give me a thumbs up if you got it. Everyone give me a thumbs up. So not only for learning this or understanding this, yes, for your competitive exams, your university exam, this topic is important, but in practice also this is important. So that is my point. So once you will be there in the field, once you will start your practice, you have multiple options. Everyone will approach you, doctor, please prescribe my drug, doctor. So various pharmaceutical companies will approach you, so please prescribe my drug to your patient. So my drug is better than other drugs available in the market. So you should ask how it is better. Prove that it is better. Does your drug is more potent or more efficacious than other available options present in the market? So if your drug is of course better than other drugs, I will prescribe your drug. Now you have to take other factors also in consideration. It is not always potency and efficacy are the only two criteria. No, you have to consider the cost effectivity also. Now some drugs are more efficacious but they are very costly and your patient is not affording, so you should prescribe such drug which is relatively a little bit less efficacious but cost wise the patient can afford it. So and not only this, you have to consider the comorbidities of the patient also. It is not always ki which is best drug available, I will give that also, but although the patient the other comorbidities, for that the drug is contraindicated, the best one is contraindicated. So don't give the best one. उसके बाद जो दूसरी है third है वो give which is not contraindicated in the patient. Just suppose patient is having diabetes, patient is having asthma, so beta blockers are contraindicated. So if you have some other disease for which beta blocker is the best efficacious drug, you cannot give beta blocker although it is best efficacious. It is contraindicated in the patient based on other comorbidities. So based on the cost, other comorbidities, based on the clinical profile of the patient, you have to take a choice between multiple drugs. Not only one, two, three. You have hundreds of drugs on your table which you will prescribe for your patient. You should have knowledge for that. So that is pharmacology. That is the importance of clinical pharmacology, how you apply the clinical pharmacology in your day-to-day practice. Have you got it? Give me a thumbs up. So being a good doctor, a good practitioner, you should know all these things and apply all these things in your day-to-day practice. Then you will be a good practitioner, a good doctor. Give me a thumbs up. Everyone give me a thumbs up. So this is the summary. I guess you got the summary. You got the summary. It is written in front of you. Let me summarize for you. Okay. So the two things I have already taught you is potency and efficacy. Potency and efficacy. You tell me the definition. Potency is the amount of drug. or dose of drug which is required to produce a particular response. Efficacy is the response, maximum response, the maximum response drug can produce at whatever dose. The maximum kitna kar sakta hai. So maximum doses pe maximum response that can be produced. So of course it is measured on x-axis, it is measured on y-axis. Right, because it is the drug. So drug dose logarithm I'm taking on x-axis and response I'm taking on y-axis, right? The summary says that the drug which is on left side is more potent and the drug which is tall or peak, one and the same thing, tall or peak is more efficacious. So left and right is on x-axis and tall and short is on y-axis. So that is the summary. That is the summary. Now, if you find some difficulty that one drug is more potent and other is more efficacious, which is the deciding criteria? So you already know the answer. Efficacy is more important criteria, clinical criteria to do the selection or choice of drug as compared to potency. Give me a thumbs up. This is the summary which is written in front of you. I think it is crystal clear to you. So it is on x-axis, the potency. The y-axis is the efficacy. It is the amount of drug needed to produce a particular response. It is the maximum response which the drug is producing. It is left and right. So left is the drug more potent. It is tall and short. So taller or peak of the drug is more efficacious. So the summary is in front of you. So there are now, if you read any book of pharmacology, the KDT, Katzunk, any, you will find such statement throughout the book. So you will find, just suppose aspirin is less potent and less efficacious than morphine. Both are analgesics. What do you mean by analgesic? So both are painkillers. So your patient is having pain. Your patient is having severe pain anywhere in the body. So aspirin and morphine both are painkillers available to you. So you should compare potency and efficacy. So aspirin is less potent as well as less efficacious than morphine. So analgesia wise, morphine is a better option to decrease the pain. Give me a thumbs up. Like Pethidine and morphine, again these are two analgesics. Again these two. Pethidine is less potent but equally efficacious than morphine. So now something, it can also happen a clinical scenario. So potency wise you can see this is the order. So okay, potency wise A is more potent than B, but efficacy wise you will say A is equal to B. A is equal to B. So I know clinical criteria is efficacy, but efficacy wise they are equal. Then the second criteria will be the potency. So prefer drug A. Efficacy wise both are equal now. So prefer drug A. So that is the thing. So here you will prefer morphine. Give me a thumbs up. Furosemide is less potent but more efficacious than metazolam. Both are diuretics. Both are used to treat edema. Both are diuretics. So your patient is having severe edema, elephantitis or some severe edema. So you want to reduce the edema of the patient. So you have two drugs, furosemide and metazolite. So furosemide is less potent but more efficacious and metazolite is more potent but less efficacious. So of course efficacy will be the cutoff you will use. So I will prefer furosemide in my patient. Give me a thumbs up. So this is how you have to do comparison, back to back comparison of two criteria, potency and efficacy for various diseases. These are the diseases. So you require an analgesic drug, you want a diuretic drug, you want a CNS depressant, you want a CNS depressant for sleeping pills. So the patient is having insomnia. Patient is coming to me, doctor, I can't sleep the whole night. Give me some drug so that I can sleep for that few hours. So patient wants a tranquilizer. Patient wants a CNS depressant. So I'm having diazepam also, phenobarbital also. Both are sleeping pills. So diazepam is more potent but less efficacious. And phenobarbital is more efficacious but less potent. So I will prefer phenobarbital. So that is the thing. Give me a thumbs up. So this is how you can decide for the same disease, how various drugs between potency and efficacy, we have to do a choice. You are not giving a thumbs up. Have you got it? Now I will ask few questions to you if you got the concept. If you got the concept, you have to answer it. Okay, let me see your chat. Yeah, I can see your chat. So everyone will answer, huh? So see, first understand my question, what I am asking. See this question, this is question number 1. Answer 2 things, okay? Okay, and this is my question number 1. So same graph, I will ask 3 questions. So this is my question number 1. Please read the question and answer it. What is my question? Compare drug A and drug C. Drug A and C. Compare it. Compare it. So first tell me the order of their potency from A and C. And first then tell me the order of efficacy. So who is more potent? Who is more efficacious? Just answer it. Compare only A and C. Don't take B in consideration. A and C. Who will answer? Kuldeep, Pooja, Rishinika, Bablu, anyone else? Who is more potent and who is more efficacious? First tell me potency. So Kuldeep is saying A. Rishinika, don't take B in consideration. I'm talking, my question is about A and C. So don't confuse anything. A or C ko compare karo, don't take B in role. So A and C may say, tell me the answer. Don't tell me the sequence. Tell me the answer for potency. So potency wise, A and C में से left कौन है? A is on the left. So A is my answer, right? Efficacy wise, what is your answer? So efficacy wise, both are at the same height. Both are at the same height. So A is equal to C. A is equal to C. So here A is more than C and A is equal to C. So what you will prefer? My third question. What you will prefer for your patient? You will prefer A or you will prefer C? My question is about A and C. So potency wise, you are looking, so A is more potent than C. Efficacy wise, you are looking A is equal to C. Give me a thumbs up. What you will prefer in your patient? What you will prefer in your patient? So Kuldeep, why you are saying C? Of course it is A. A and C both are. So I know that efficacy is a strong criteria, but efficacy wise they are equal now. So the second criteria which I should look for is potency. And potency wise A is more potent than C. So I will prefer A in my patient. So this is the summary of this graph. This is the summary. Do you have any doubt in this? So in every graph, you have to answer three things. What is the potency of the particular drug I am asking? What is the efficacy? And finally, summarizing it, what you will prefer in your patient, my third question. So potency wise, answer is A followed by C. Efficacy wise, answer is A is equal to C. And final summary, I will prefer A in my patient. So if I am having two drugs for the same disease, A and C, I will prefer A if this is the criteria. This is the scenario. Give me a thumbs up. So potency wise, A is the answer. Efficacy wise, both are equal. So finally, I will prefer A in my patient. This is the summary. This is my next question. Please understand the question first. Compare A and B. Don't take C in rule. Compare only A and B. This is A, this is B. Now compare both things. First, tell me the potency of them, the sequence of potency, and then tell me the sequence of efficacy. And then tell me final what you will prefer in your patient. So who will answer? Potency wise and efficacy wise. Okay, पहले efficacy बताओ यहाँ पे. Efficacy is easier to answer. Efficacy बताओ. What's the order of efficacy? See the height of A and B. See the height of A, height of B. Of course, A is taller and B is shorter. So answer is A followed by B. A is taller, yes? So A is followed by B. So efficacy wise, A followed by B. What about potency? Potency wise, you will say, ma'am, left, right hai. Okay, I told you that the one which is on the left is more potent, but approx they are same. See, left, right mein itna kuch difference nahi hai, so I can neglect it. So a small, so this is on the left, this is on the right, but it is a very small difference, so we can neglect it. So neglect karke answer will be like A is equal to B, potency wise, because left right में बहुत ज़्यादा difference नहीं है, या A and C में ज़्यादा है. A is on the left side, C is on the right side. You can see the difference between them on the left right. But here the left right difference, you can see it is very minute, hardly any difference is there. So you can neglect it. So now see the last scenario. Last scenario में efficacy wise they were equal, potency wise they were different. Here scenario potency wise they are equal, but efficacy wise they are different. So what is your answer in your patient? In your patient, what you will prefer? Potency wise A is equal to B and efficacy wise A is better than B. So of course you will prefer A. Of course you will prefer A. Give me a thumbs up. So ultimately you are preferring A from C also and you are preferring A from B also. So combining A, B, C, your answer is A. Your answer is A. Have you got it? Now compare B and C. My third and last question for this. B and C. Don't take A in consideration. B and C कौन compare करेगा? B and C कौन compare करेगा? Tell me potency का order and tell me efficacy का order between B and C. Between B and C. So compare B and C. So ये B है, ये C है. Anyone wants to compare B and C? Anyone wants to compare? Pooja, Kuldeep, Rishinika. Please others also please participate in it if you got the concept. Compare B and C for potency. So B is on the left side, C is on the right side. So of course B followed by C. Yes, very good. B followed by C. Very good. And efficacy wise, C is taller and B is shorter. C is taller, B is shorter. So C followed by B. Now tell me the third question which has become most difficult for you. Tell me the third question which is most difficult for you. Which you will prefer in your patient? You will prefer B or you will prefer C? तुम फंस गए धर्म कांटे में. अब क्या करोगे? So efficacy is more significant criteria than potency. So I will prefer C. So see the summary of my three questions. So my first question was this. If any drug having same efficacy but different potency, so you consider potency. If any drug have same potency but different efficacy, you consider efficacy. But there are two drugs, one is more potent and one is more efficacious, and prefer efficacy. Give me a thumbs up. You got the concept, I guess. So this is next question. Here 4 drugs are there. I will ask few questions from this question also. You want more questions? So this is one more question I have put to explain you potency and efficacy. Then I will come on the third criteria. See, there are 4 drugs. So this is drug A with red color. You can see drug B with green color, drug C with blue, and drug D with purple. You can see 4 drugs A, B, C, D. You can see left and right also of each of them, and you can see the various height of also of each of them. Let me ask the question. This is my question. Who will answer it? Who will answer it? I am asking compare drug A and B. So see only A and B. So see this A and see this B, the red and the green graph. Tell me potency, the order, and tell me efficacy, the order. My two questions. Potency का order क्या है? A and B में. Who will answer? So B is potent. Yes, Pooja, you are very right. B is potent. Anyone else? So B is potent than A. No, Pooja, no. B is potent. No, potency wise A is more potent. No, the drug which is on the left side. You are talking for the same question? Yes, rest all are right. A followed by B. Potency order is A followed by B. A is more potent, not B. So A is on the left side, B is on the right side. Right? So the drug on the left side is more potent. So A followed by B. What about efficacy? See the height of each of them. See the height. So both are having same height. So A is equal to B. Efficacy wise. So what you will prefer in your patient? What is the final answer? What you will prefer in your patient? A or B? What you will prefer? Efficacy wise, they are equal. I prefer to take a drug which is more efficacious, but efficacy wise they are equal. Unfortunately, they are equal. So let me go with potency. So I will prefer A. I will prefer A. So that is my three questions are answered. So this graph can come and any question can be asked in your exam, right? So this is the answer we have seen. Compare drug A and C. My next question. Compare drug A and C. So see the red graph and the blue graph. A and C. Don't see B and D. A and C. Tell me potency. Tell me efficacy. Who will tell me potency का order A and C? Very easy ना, फटाफट बोलो. So yes, you all are right. A more potent than B. A is on the left side, C is on the right side. Efficacy wise, so A is taller, C is shorter. So A followed by C. So here both answers are A. Potency wise, A is better. Efficacy wise, A is better. So I will prefer A in my patient. Give me a thumbs up. So these are the various scenarios when you will face in your day-to-day practice. My last question. Compare drug D with all others. Compare drug D with all others means A, B, C तीनों से compare करो. Drug D with all others. Where is drug D? So here is the drug D. So if you see potency wise, it is on the most left side. Most left side. It is on the most left side. So it is most potent. It is most potent. Most potent. Right. So D is more potent than A also, B also, C also. Give me a thumbs up. Most potent. But what about efficacy wise? Efficacy wise क्या है? इसकी height देखो. इसकी height. The height of the D is same as that of C and it is less than A and B. So efficacy wise, it is same efficacious as C. But A and B, as compared to A and B, it is less efficacious. So that is the thing you should see. So I am done with potency. I am done with efficacy. Do you have any doubt in understanding it? If you have any doubt in understanding it, please let me know. Otherwise, give me a thumbs up. Otherwise, give me a thumbs up. Everyone give me a thumbs up. So I'm done with potency. I'm done with efficacy. Potency and efficacy. So the third criteria slope, the fourth criteria therapeutic index, and fifth criteria therapeutic range. I will continue with this topic with a break of 5 minutes. After that, I will continue. Let me announce few announcements. There are few important announcements for you people. Today I'm taking an open house also. So give me a minute to announce it. Then you people can take a break for 5-10 minutes and we will join back after 10 minutes. So thank you very much for being with me for this lecture. Don't forget to write your feedback for this particular lecture in the comment box. If you feel like anything, you are free to write. Give your precious suggestions. Next class is just after 10 minutes. That is at 10:45. 10:45. Now it is 10:30. Just after 10 minutes, 10:45 a.m. we are having the next class, right? So stay connected. In the next class, I will continue this topic, that is DRC. First, I will finish DRC. Then I will teach you various transduction mechanism of the various receptors and pharmacodynamics. So next class is going to be very important. After 1 hour, this is a 1 hour class. Listen my schedule ahead. This is a 1 hour class. We will take again a break for 15 minutes. And at 12 p.m. today, I am having a class of pathology. My topic for pathology is hepatitis. The viral hepatitis, acute, chronic, fulminant, A, B, C, D, E, all hepatitis in detail I am going to teach you today. Don't miss that. So the next lecture is pharma only. After that next lecture is patho. And after that at 1 p.m. sharp, I am having an open house today. What do you mean by open house? I will share the link of the open house in my last lecture only. I will pin in the chat. And I will share it on the WhatsApp also and Telegram also. What you have to do, you have to just click on the link. So it is an audio room. You can talk to me. Here you can hear my voice, but I cannot hear your voice. Now, we cannot see each other in open house, but we can talk to each other. So anyone can talk to me. So Kuldeep, Pooja, Bablu, anyone. So anyone want to get connected with me? So you have to send a request. I will accept the request one by one of all students and you can talk to me. So what you will talk to me? You can ask your doubts to me. So based on hepatitis, once I will teach you hepatitis, So you can ask any doubt based on hepatitis to me directly. You can ask, ma'am, this is the question. So here it is given this here. So what is the concept or whatever? We can have a talk. You can hear me, I can hear you. You can talk to me, I can talk to you. So we have conversation with each other. So that is the significance of open house. So I invite all of you for my first open house today. So you all are welcome for my open house. I will share the link. Just you have to click the link. It is not video. We cannot see each other. Like here we can see each other also, and only I can talk. You cannot talk. But it is an audio room. It is a podcast. It is an audio room. It is not video. It is only audio room. We will be there in a room and we all can hear each other. So that is the audio room. That is open house. So today is my, every day I will take open house, and it's just for 10 minutes, 15 minutes, 10 minutes I will take. It is not a 1 hour class. So for 10-15 minutes, we can hear each other. Whatever doubts are there, you can directly, instead of writing in the chat, directly ask me. So yes, will you come in my open house today? I want everyone to come on the open house. I will share the link and please everyone come. After that, I am having one more announcement. All the aspirants of NEET PG 2022, please give a all India mock test, which is going to happen on an academy on 26 Feb at 9 a.m. in the morning. The pattern of the questions is the predictive of the main exam. So please everyone participate, everyone, and share this information and link with others also, and enroll now. It is free. So everyone should participate. Those who want NEET PG notes, so an academy is going to come. The next step, the notes. Those who have a addiction of the notes. So we are coming up with the notes. So stay connected. And yeah, there is a combat test which is going to happen on 19 Feb at 6 p.m. So the topics will be, the subjects will be ortho, OBG, surgery, and pediatrics. So you should participate, and you can win the amazing prizes. Amazon gift voucher, the lucky participants can win, the winners, right? The last thing is that if you take any subscription, Plus or Iconic, you know there are two type of subscription, Plus and Iconic. So if you take any subscription before 19th February, instead of 10% discount, you will get 20% discount if you use my code. My code is Sachdev10. So if you're thinking of taking an academy subscription anyhow, take it before 19 February. 19 February midnight is the last time you can grab this opportunity. So instead of 10% discount, you will get 20% discount, right? So thank you very much for being with me. These are the batches. Once you take the subscription, and you can see the normal price. This is the normal plus price, and this is what we are offering now till 19th Feb. And this is the normal iconic price, and this is what we are offering now till 19th Feb. You can see how much you can save if you take the subscription today and tomorrow. So don't miss out this opportunity, and please join me back just after 10 minutes at 10:45 sharp. So we will continue. Okay, bye bye. Study hard, and I'm ending this lecture. Please come back. Everyone come back after 10 minutes.